series on COVID-19 and healthcare systems in Israel and Palestine. Today, we're going to hear from another outstanding panel of experts from diverse backgrounds. We're going to discuss the current impact of COVID-19 on Israel and its future implications on the healthcare system and the populations there. So first, we are going to have with us Ran Goldstein. Ran is the Executive Director of Physicians for Human Rights in Israel. He was previously the head of communications for the International Red Cross and Red Crescent Movement delegation to Israel and the occupied territories, and senior strategy and communications consultant to various Israeli civil society organizations. And second, we are pleased to welcome Henriette Shakar, who is a Palestinian editor and a reporter at 972 magazine. She also produces, hosts, and edits the 972 podcast. Henriette is a graduate of Columbia Journalism School and previously worked at a weekly paper in Maine and Rain Media for PBS Frontline, as well as The Intercept. As with our previous events, this is, of course, a virtual meeting, which is what we are having to do in this new era. Yet we look forward to taking audience questions through the Zoom features for Q&A, which many people on this podcast, the webinar, are now getting very familiar with, I think. So you'll see that at the bottom of the screen. Please put your questions into the Q&A box and not the comment box so we make sure that we see them. For those calling in by phone or watching the panel live stream, you can ask a question on Twitter. The hashtag is MEI-events, or you can email events@mei.edu. Please save the Zoom chat function for technical issues you might be having, or you can email again events@mei.edu if you have questions. And feel free to ask your questions throughout the panel, and Khaled and I will be keeping an eye on them and be asking them, weaving them into the discussion or using them as we get done with your first rounds of questioning. So I am going to lead off the first round of questioning. I'm actually going to turn to Henriette. Henriette, can you give us sort of a snapshot of where things are today? And I know it's a moving target day to day, where things are in terms of numbers, in terms of closures, in terms of the populations that are sort of most in the spotlight. So can you just give us sort of a framing snapshot of where things are?
Of course, just want to say hello to everyone. I'm joining you from Haifa today. So as of this morning, we have had more than 7,000 Israeli citizens test positive for the coronavirus. 39 have died and more than 350 people have recovered. According to government orders, citizens must shelter in place. They are only allowed to walk up to 100 meters away from their homes, with exceptions for getting groceries or seeking medical care or attending to approved jobs. We are also seeing, as of today, a closure on the city of Bnei Brak, which is predominantly ultra-Orthodox. People who violate these orders risk getting fined or even jailed. And we also saw some 500 soldiers from Israel's army join the police to help enforce these precautions. And as of Wednesday, Israelis are required to wear a mask when they're in public spaces. So we're seeing the government sort of trying to figure out how to tighten the restrictions and make sure everyone's obeying the sheltering in place orders as the cases climb and as more people get tested.
I'm wondering if I could put a question to Ran. We saw in the midst of this COVID crisis, we saw Israel was already in the throes of another crisis, a political crisis, and a stalemate. I'm wondering if you could tell us the extent to which the coronavirus crisis played into the political stalemate in Israel, and how.
Yeah, okay, so good evening from, at least in my side, it's evening, and thank you for the opportunity to speak with you. As Lara mentioned, I'm the Director of Physicians for Human Rights in Israel. Khaled, I will in a minute answer to the question. I will say that we are promoting rights to health of everyone who lives in Israel and in the occupied territories. And the idea of the organization is to combine humanitarian aid and also policy change. I must say that I think it played a big role in the fact that the Kachol Lavan, Benny Gantz, believed that the corona was the reason why he can actually not keep the promise to the people who elected him and go and do a coalition with Netanyahu. That's how it looks like. So it looks like it had a major impact. I must say that now in Israel, just to add to what Henrietta said, that we're starting to speak about the exit plan. It looks like in a week and a half, something like that, after the Passover holidays, the government is starting to plan how we will go back to normal. It will take some time, probably more than a month at least, but they're starting to see the curve of the people who are infected. The curve is going, more straight, and it's looked like they took good measures in the beginning of the crisis. Although obviously what we see is the gaps between the different populations that we see always, it's just came up much more wider now during the crisis.
Still learning to unmute myself. You think after 3 weeks of this, we'd be better at it. I want to follow up on that question. So again, to Henriette, there have been a lot of reports in the media about the government's response, right? And about the politics of it and how this has played out. There is reporting that suggests that there are those forces in the government that are taking advantage of this crisis, whether it is to challenge Israeli democratic institutions, the courts, the Knesset, or whether it is about implementing more maybe draconian or illiberal policies, whether it's vis-a-vis surveillance of the population, or someone look at maybe what we saw in Jaffa over the past couple of days, the really extreme crackdown. Can you comment on that, both in terms of whether or not what we're seeing in some cases is maybe a misattribution, where some of these are just policies that are not about the Israeli-Palestinian conflict or about racism, it's just about a difficult challenge, and where in fact what we are seeing is a magnification of policies that already existed?
Certainly. I mean, it's terrifying to see the government use this public health crisis to get away with the things it's been able to get away with. And it's safe to say that if there weren't movement restrictions in place, the pushback on these things would have been more visible. I have to say that some of these developments are not surprising. Some of them are just a natural reflection of Israel's further shift to the right. But we are seeing some unprecedented policies and practices happen. Politically, we saw the Knesset chairperson, Yuli Edelstein of the Likud party, basically hold parliament hostage for several days. He used the health ministry's restrictions as an excuse to paralyze government. In a commentary piece for 972 magazine, human rights attorney Michael Spard described this as nothing less than a coup. We also saw Justice Minister Amir Ochana, also of the Likud party. He was appointed by Netanyahu, actually, shut down the courts using the coronavirus as an excuse. In effect, it postponed Netanyahu's trial, which was scheduled for March 17th. He's facing 3 criminal corruption charges. But we're also seeing the effects on the ground. Like you said, Netanyahu announced and approved the insane surveillance measures, giving this task to the Shin Bet, the country's secret service. And as Ido Conrad wrote for the magazine, these technologies, there's nothing new about them. We've seen them being directed at Palestinians, both inside Israel and in the occupied territories. The difference is now they're being used against Jewish Israelis, which is a scary development. We know that usually what is approved during a time of emergency, during a time of crisis, is only later normalized, not taken back, not withdrawn. We are also seeing that the work of human rights organizations is being challenged. Again, because of the movement restrictions, researchers are not being able to monitor what's going on the ground. But at the same time, the abuses carry on, from settler violence to arrests to home demolitions. And I'm sure that some of these violations came up in the previous 2 webinars, but they don't stop at the occupied territories. They're also happening in Israel. And like you mentioned, what happened on Wednesday in Jaffa, basically it started with a teenager being asked to show his identity card to a police officer, and he didn't do that. He either refused or didn't have it on him. It's unclear exactly what happened. But the police chose to respond with severe violence, with many forces entering the city, closing the entry to the city, using stun grenades, rubber bullets. It raises questions about unequal enforcement of the coronavirus measures. And Palestinian citizens are worried that they would be disproportionately targeted. It's even worse when you see footage from that day with police not wearing protective gear, not wearing gloves or masks as required. And they're not only endangering themselves, but the residents as well. So there is this gap between needing to enforce self-isolation, while at the same time not fully understanding, it doesn't square with the cracks that are already part of the system and the discrepancies that are, have been in place for years.
Yeah, may I add to part of what we see, and the discrimination is also the way how Israel managed the testing kits. So there are much less Arab population in Arab area where Israel did testing for the population to even check corona. In the beginning of the crisis, a lot of the materials, the publication of the Ministry of Health, how to behave were not even translated, not to Arabic, not other languages. Population like asylum seekers were not aware at all about what's going on. So organizations like us had to join, to intervene and be more in, as the messenger from the Ministry of Health to the communities, because the Ministry of Health are not on daily life, don't have any knowledge about them except of the fact when they are really in a disaster situation, in emergency, and they're arriving to the hospital, so they don't have health insurance. And I know maybe in the state it's something that sounds okay. Many people don't have health insurance, but in Israel, the public health insurance is something which you're obliged to have from when you were a kid. Even if I would not pay the insurance to make it, of the fee of the insurance of my kid, they still will have an insurance, health insurance. So it's such a basic rights here. When you see all those gaps, if it's asylum seekers, if it's prisoners who are in prison, or even, in areas in Israel when you have Palestinian citizens of Israel, and even, in more peripheral areas when they don't have the best services. And you see, for example, the fact that Israel didn't translate in the beginning, it's changed now, but didn't translate everything to Arabic. It shows how much is, for example, education, it's important. So everything in the end, it's related to health, and those gaps really are pumping up during this period. And I also see, it's kind of an opportunity to show that, we have, when you have an epidemic crisis, you see why it's such an important thing to have equal rights to everyone, and especially in health.
Yeah, I want to reiterate that point and say that, the virus did not necessarily create new challenges. What it did is exacerbate existing tensions and injustices. And there's really 3 ways that we can trace that and see how it's hitting vulnerable communities hardest. As Ran mentioned, we see that the health ministry was delayed in publishing information and instructions in Arabic and other languages. We're seeing gaps in the provision of medical care. And we're seeing that there's unequal access to services and financial assistance. And it applies to, from asylum seekers to Palestinian citizens of Israel to prisoners. We can really go in depth in each one of those communities.
Thank you both. I mean, the question that occurs to me is, things like police brutality against the Palestinian minority in Israel are not that new, obviously. Are these reactions that we're seeing or that are being televised or broadcast to us, are these a result of sort of an atmosphere of fear and insecurity in general, and the police are sort of agitated, and the general public is afraid? Or is it simply there were cameras in the right place at the right time, and that this is essentially par for the course? I'm wondering, I guess, part of my question is, could you put in context for us, what is the mood inside Israel among the Jewish majority, different segments of the Jewish population, poor, rich versus poor, the Palestinian minority? Is there a general confidence in the Israeli government, in its preparedness in general? Could you sort of just give a sense of the mood? Is there widespread fear, given that Israel right now, the infection rate seems to be ballooning in Israel, and it is Israel has the second highest number of cases in the Middle East after Iran. It's a bit of a distant second, but in terms of population proportionality, it seems to be increasing at an alarming rate.
So first, I think Israel entered the crisis with a health system which was already in a crisis. This is one thing. And I think regarding the atmosphere, so it really depends where you live and who you are. And, I'm not a Palestinian citizen of Israel, so I don't feel the same. For example, even on regular days when I go to the bank or to the supermarket, I'm not afraid to be, people from racist comments, for example, which probably Palestinian citizens of Israel will be afraid, and this kind of feeling always put you under tension. I will be now, for example, will be, maybe someone will see me and say, you are a lefty traitor, this is something else. And we saw like a week ago, the police chased after someone who did jogging in the park in Tel Aviv with an helicopter and two police cars inside the park, really chasing about someone who just did jogging or cycling, something like that. I think it was cycling. So I think the police is on the limit. The police is really, when you push the police and when you push the army in the occupied territories, they know they have a certain role, they play the role. The role of the IDF was to security, the police was to make order, but you need other systems to be involved, to be able and make everyone calm. And I'm afraid that when we enter the crisis, already the trust of the public, okay, maybe not all the public, but the trust of the public in the dignity and in the the transparency of the government, it was not very high already. So when they now, for example, when Netanyahu is doing every day, now less, but when he did every day, like a press conference in the evening, 8 a.m., did speech to the people, I don't think it gave a lot of confidence. I think when the more professional level spoke, it was more, I think people listened more because they understand that it's not a political thing. Although I can tell you that everyone, from my sources, from the beginning, it obviously people or the government use it also for political reasons. However, it is a real crisis, and the measure that they took, they had to take. And always now it's easy to say, but even if they would have taken that before, we have been in a better situation now.
Just to add to that, we're also seeing that the way the government is framing it, I think, is a little confusing, because when Netanyahu describes this as a war, the enemy here is a pandemic. It's invisible, and it's supposed to take, the approach has to be different when you're dealing with a public health crisis. And so we're seeing confusion both on the authority side, the enforcement side, and with vulnerable communities, because we're seeing, like I said, police not understand that this is not about a show of force. It's about taking the necessary precautions and really raising awareness so that people understand what the risks are. It's not about using more force. But we're also seeing that, especially Palestinian citizens, there's already a fraught relationship with these security forces. And so just because the enemy now is a pandemic, like, of course, people have to stay at home. Of course, people have to understand the risks involved. But the problematic relationship with these security forces cannot disappear overnight. And so I think there is a certain kind of fear, but there's also trust that cannot be bridged just because the enemy now is a pandemic.
Could I ask you both to go into a little more detail, I think either one of you or you both, on some of the different communities that are more vulnerable here? I'm not sure everyone listening, I think there's a lot of people on the call who have a lot of knowledge, but for example, there was an article in 972 the other day about the danger of COVID in the Bedouin communities, which are already vastly underserved and quite isolated from Jewish citizens of Israel. There was another article I saw somewhere looking at the danger of things sweeping through Palestinian camps that are outside of Israel. I know that's beyond your look. There's sub-communities, the prisoners, for example. There are sort of sub-communities that people are looking at and saying, wow, if we don't actually deal with this head on, this has implications that are catastrophic within the communities, and beyond those communities has implications because, as we said, the pathogens are not interested in borders.
So if I may start, I want to start with the community you didn't mention, which is the statusless people in Israel. You have the migrant workers, you have the asylum seekers, refugees, you have, Palestinians who enter Israel and now they are here with permits, they stay here. They are or the LGBT who cannot go back to the occupied territories, or they were, they cooperate with the Israeli authorities in the past. And those people, there's no health insurance. Those people are living, around, and we have a open clinic in Jaffa, which is exactly, were established exactly for this purpose. But when the crisis started, the Ministry of Health, when we contact them to ask, okay, what are you going to do? Because those people doesn't have an insurance, they will be afraid to come to the hospital, first of all, because they don't want their information to be transferred to the Ministry of Interior, for example. So all that things we had to intervene in the beginning, and I think it was very frightening. And we know about cases of people from asylum seekers community who were afraid to go to the hospital in the, in certain point, even when they were sick. So it's something that, and I think it's something that the government should understand, that the people who doesn't want to be in any communication with the authorities also don't trust them during the epidemic. As for the Bedouin communities, I think it's always a big gap in discrimination in health conditions. I think Israel must have a specific plan, but I want to also mention the role of the civil society these days. Always, we have the role of, it depends on the organization, but we usually have the role of those who find the negative point and highlight them and demand from the authorities to change policy. And I think we have another role in these days. I think our role is also to be the one who help the authorities, help the government in communication with the different populations, and also serve, have a benefit from the fact that we have good connections on ground and try to help help both the government or the authorities or the health services to help them implement the role, and from the other end to demand the rights of all those communities.
Definitely, and just to put things in context a little bit, the unemployment rate in Israel right now is close to 25%, close to a quarter. So many people are at home, many people are nervous, not much to do, and it's multiplied when you're someone without status or someone without access to the services you need. And just to give an example with the asylum seekers, as Ron mentioned, it's not just about not being able to access medical insurance. it's also the living conditions that these people are in. Many times they're in crowded spaces, they live in 1 or 2 bedrooms with several other people. So even just the basic order to self-isolate is made challenging. These are people who work mostly in the service industries, hotels, restaurants. They don't have extended family or savings to rely on. And without if they're laid off, they don't just lose their private insurance if they have it, but they also can't provide to their families. Again, the issue of the language is extremely important, because I agree with Ron here that civil society organizations have really stepped up where the government has been slow or has even failed at times to respond. And we're seeing the same thing happen with Palestinian citizens, where the High Follow-Up Committee, which is an umbrella organization representing the Palestinian citizens, has put together a nationwide emergency relief group that operates across different Arab cities and towns. And where the government was slow to publish information and instructions, they stepped in. They're also helping, providing medical and psychological assistance to people who need it. We've seen how Palestinian politicians have pressed to have more mobile testing clinics, which is something, it's kind of crazy to think that only in the last few days has been made accessible in Arab cities and villages. Again, David Adom, the medical emergency services, only a few days ago announced that they were going to open a hotline in Arabic. It's all these things that are invisible, but at a time of pandemic are really highlighted. These inequalities that are ongoing and that are there on a daily basis at a time of a pandemic are really magnified when we need to act quick and the infrastructure is not in place. And just to go to the Bedouin communities, as you mentioned, Lara, the people especially at risk are the Bedouin communities in unrecognized villages. Again, these are people who live in crowded conditions with no access to infrastructure. So basic services like water, sewage, garbage collection, access to electricity are not available. If the medical emergency services have to attend to a patient urgently, there aren't paved roads that can help them get there easily. In the meantime, Israel has continued to demolish homes and raze their land. Weeks into the outbreak, the government has said that it's going to stop these demolitions, or it may have already stopped. But it took it time to actually realize that business cannot go on as usual. And so, yeah, these discrepancies are very much still in place. Yeah. We're also seeing it with remote education, for example, when the state shifted to online learning, it didn't take into account that about half of Palestinian students don't have access to computers at home or a reliable internet connection. Yeah, so it's the everyday moments that suddenly are very important at a time of a pandemic.
We have a couple of follow-up questions or questions asking our panelists to follow up or clarify. One, this can be for either of you, but I think it's directed at Ran. Could you provide a little bit more detail on the situation of asylum seekers? And there's also a question about, there are a number of questions about these marginalized communities, or communities that sort of fall through the cracks, asylum seekers, but also the ultra-Orthodox, which hasn't really come up yet. We're seeing large infection rates in that community. So I'm wondering if either of you could address those issues as well.
Yeah, so as for asylum seekers, as I mentioned before, we did a lot of, I think, work with the Ministry of Health, so to ensure that they will, for example, when they go to hospital, nobody will charge them backwards about the treatment during the Corona time. So we have a promise and letter, it's written from the Ministry of Health, that if asylum seekers goes to hospitals and need a treatment during the Corona times, he won't be charged. Another thing, for example, in a few days, like Sunday, Monday, there will be a testing place also in the central station of Tel Aviv, exactly because of that. I think asylum seekers, as my colleague mentioned, they live sometimes in crowded places. They don't have all the time. They live in few people in the same apartment. They cannot be isolated. And when they sick, they don't, if they don't come to us or other places where they can get treatment, they don't have any access to usual health services. So I think it's something that was taken after we intervened, taken quite seriously by the authorities, I must say. And I think, as I mentioned, it's an opportunity to show that everyone needs, in the end, to have the basic access to health services. Although the government, there are the more the political side, like Tzipi Hotobeli, the minister, or Yariv Levin, the minister, they think this is an opportunity to deport people outside of Israel, but I think nobody really take it very seriously.
Amrita, did you have anything you wanted to add on that one?
On the ultra-Orthodox also?
Oh. Yeah.
I will say about the ultra-Orthodox, probably Ran can say a lot more about what the state of how the crisis meets that community is in more detail. But I will say that one of the challenges has been that the ultra-Orthodox communities were slower in accepting the self-isolation orders. And so people were still going to prayers, still going out in public spaces and not really sheltering in place. And we're seeing that this is where most of the hotspots in the country are now happening. That's where most of the cases are growing. But maybe Ran has more to add on that.
Yeah, it's looked like because of the life conditions and the crowded and they live again, there are sometimes it's 10, 15 people of the same families. And since probably the precautions were not the same, and it took more time for the population to follow the instructions. It was quite obvious, by the way, that it will happen in these places. Like, obviously, it will happen in Gaza, unfortunately. And, the number of people who are now in Gaza are affected by the coronavirus is low, but also the number of testing is very low. I want also, but to mention that we need to be very, very careful with stigmatization of populations, because you already see, in the Hebrew, in Twitter in Hebrew, what people think about Ultraorthodox, what they think about the Palestinian citizen of Israel, what they, everyone who is kind of minority. So although the Minister of Health is Ultraorthodox, I think he has the way he manages it, and he doesn't manage it actually, it's outrageous. And I think he was, even before the crisis, is not someone who deserves to be the Ministry of Health of Israel. I think he has a lot of responsibility for what's happening also in the Ultra-Orthodox communities. We know from the day, even before the corona, how people from the Ultra-Orthodox community sometimes approach him directly, and he helped them to get treatment, which is anyone else will not get it if he doesn't call to the minister himself. And I think he needs to be take the responsibility also about what's going on now in the Orthodox cities. But from the other end, again, it's the role of civil society, it's the role of the municipalities, the welfare services to intervene and to try and hopefully, and I'm an optimist, probably that's why I do what I do. It's a kind of an opportunity that after the crisis, we will go back to, and hopefully it will be a different world. It will be obviously a different world, but hopefully it will be a little bit better as well.
There's a question from people tuning in that I would like to answer, because I do think it's important if that's okay with you guys. The question is, what's the situation of women during this crisis? And this is another vulnerable group that I do think is important to talk about, because we're seeing, as in other places around the world, women are carrying more of the burden of balancing the different responsibilities at this time of crisis. We're seeing people or women specifically have to care for children at home, but also maintain the responsibilities for work, care for the elderly in some situations where that's the responsibility in the family. We are seeing this heavier burden, both in Palestinian communities in the occupied West Bank, but also inside Israel, where women have been talking about how there's really a huge challenge to kind of stay together during this time. So it's great to see that there's also access to mental health services that's being offered right now by these emergency relief committees that I mentioned before. We're also seeing a challenge answering to domestic violence cases. When the precautions are to shelter in place, what does that mean for someone who is not safe at home? And so we're seeing the authorities trying to find responses to that and find ways to offer help to these people who can't, where home is not a safe place. So just to answer that question.
And I saw also a question, if it's okay, about East Jerusalem and who is responsible and how it will be managed there. And there is no enough testing in East Jerusalem. So obviously Israel should be the one, because the people who lived in East Jerusalem, most of them residents, and they have health insurance in the Israeli health companies. But obviously Israel is not really, let's say, playing the right role in those areas. So instead of really, as an occupied power, give the services that they need to give to people, they mostly use police and army, those places. From the other end, I think also the relations during this time between the PA and Israel, and even Israel and even Gaza and Hamas, is the cooperation, or at least the dialogue, is much better. You can see on daily routine between the PA and Israel how they cooperate, and I think again maybe it's an opportunity, but obviously Jerusalem should be. The responsibility is Israel, as in the West Bank, as a human rights organization. Obviously, the responsibility should be from Israel, also in Gaza, but also you have also responsibility from the PA and from Hamas, and we know about the problem between PA and Hamas and the complaints about how the PA doesn't transfer enough aid to Gaza as well. And so I hope I answered these questions about the East Jerusalem.
I just want to comment quickly on that issue of cooperation, because it's being talked about a lot as this point of hope. And I completely understand how, in this time of crisis, it is important to hold on to hope wherever possible. But I think it's important to also say that this cooperation is not out of a place of benevolence. It's very clear for the Israeli government, and it's becoming more and more clear that the pandemic does not discriminate. And so if it wants to protect its own population, it's in its own interest to take care of these marginalized and oppressed communities. And again, while cooperation is important, it doesn't make up for years of inequality and neglect and oppression. And so I think it is important to contextualize that.
Obviously it's from an interest of, obviously Israel does it because Israel has a very clear interest that they don't want to the situation to be more deteriorated in Gaza or the West Bank. But sometimes, you can start with the interest and then maybe go to the next level. I'm not, in that sense, I'm not very optimistic. But, at least there is a shared interest. We talk about responsibility. By the way, I must say that we don't hear international bodies talking about responsibility. You don't hear the UN talking about the responsibility of Israel about the Gaza, for example. You hear human rights organizations saying that, but the international community talk about this cooperation, dialogue, interest, and the goodwill of both sides, but nobody talk about, almost no one speaks about responsibility anymore.
So I wanted to follow up. I've been looking for reasons, because I don't say I'm an optimist. I want to be an optimist. I want to be hopeful that coming out of this, there will be a greater sense of shared humanity, responsibility for the other, that may lead to some better policies across the board in my country and in Israel-Palestine. I'm curious for you to talk a little bit about whether or not the Israeli public the Israeli Jewish public that is not part of the vulnerable populations cares about any of this, cares about these inequities. And at a political level, when Israel is in the process of trying to once again form a government, where the government debate really is about how right-wing it will be, whether it really is coming down to a debate about annexation, right? I saw a story today in the American Jewish press, I don't know where it's in the Israeli press, that the prime minister is basically publicly committed to not working with PHR Israel and Hamoked in these joint discussions about what to do about COVID, because you have the wrong policies when it comes down to the West Bank and occupation. That struck me as an interesting test of how much anybody really cares about the health side, or how much their politics are still going to always trump, if you'll forgive me using the word, the considerations about health.
Yeah, I think, you know, I saw what you read, and it was, you know, really in a very, really extreme right-wing website, and it's Im Tirtzu publications. There is now several roundtables between civil society and government nowadays, and we're in one of them. We don't feel, you know, that someone is going to pick us out, and it's not on. They need us this time. They really need us. And I think I go back to the question. I think people who believed, or we did a poll a week ago. So we did a poll, and we saw that the trust in the government, oh, sorry, my kids, it had to come in one point of the conversation. So we did a poll, and you see that people who vote Netanyahu, like 80% of them really believe we manage it in the right way, and those who don't, it's like 30% think it's okay, and all the other really against. So I think it's the same situation as during the elections, kind of.
I think what's interesting to see is how just regular people are stepping up. We're seeing a strong show of solidarity on the people level. Yesterday, we published on 972 an article by a group of Jewish Israelis who have decided to start an independent campaign to raise money to send medical assistance to Gaza. But more than just the immediate aid, it was important for them to also call for the end of the occupation and the end of the siege and the end of the blockade. And they tied it to the larger policies that are problematic. And they very much recognize that it's not really just about the humanitarian aid, it's about the larger politics in place. So that was very inspiring. And we're also seeing how these vulnerable, communities that we were talking about before are relying on each other. Perhaps it is because there is so much distrust with state institutions. They've really kind of established these incredible informal support networks, and we're seeing donation drives across the country. We're seeing people use the internet to sort of help families figure out this time with their children at home. We're seeing them offer mental health lessons and skill sharing classes, and we are seeing this sort of closer sense of community that's coming out of this crisis, which is really beautiful.
I also see the question about what will happen with the Palestinian workers who goes back to the West Bank, who will test them. So it's not clear yet, by the way, it's not clear if it will happen, if they will go back, because so far they allowed to stay here for a month or 2 months. We succeed to push to a new bill, which will hopefully become a law, that all Palestinian workers who are here will have health insurance. I think it's in discussions, and it's not clear yet who will test them, but obviously they should be testing, although I must say something about this testing, because from all the medical side, and I'm not a doctor, so don't count on what I say 100%, but even if someone had the virus, it takes at least 7 to 10 days until you see it. So even if someone is tested and it's negative, it doesn't mean that he doesn't have it. That's also something that we need to, and one of the main, let's say, outrage in the way that all this crisis is managed is the laboratories. It's the how, and we hear it more and more, and we get a lot of testimonies from people who deal with the tests about that, how the numbers are not, the numbers are not really real. The everything, it's you cannot really trust the numbers, because when you test someone, for example, if yesterday I met someone who has a virus and today I was tested, it doesn't mean anything. Obviously, I still don't have it. It doesn't mean so. There are a lot of mess with the testing and how it managed as well. So.
There's another group that hasn't actually come up yet, and I'm wondering if either of you could shed some light on the status of Israeli settlers. Are they subject to the same movement restrictions, and so are they basically now locked down in their homes, in their communities, in the settlements themselves? Obviously, once we're inside the municipal Jerusalem, it's a different situation. Where you have Palestinians and Israeli settlers sort of rubbing shoulders or living shoulder to shoulder. So what is the status of Israeli settlers? Are we seeing a lull, for example, in settler violence? Are we seeing the opposite? But where do they fit into the equation? For either of you.
I think it's hard to say whether there's an increase in settler violence, again, because of what I said before, that human rights organizations have been having a harder time carrying out their field work. But we are seeing this sense of emboldenment, and we are seeing more still incidents of settler violence despite the shelter-in-place orders. And we're also seeing this discrimination in settlements where, in many of those settlements, there are Palestinian workers who work at supermarkets or in construction. And at the start of the outbreak, in some of these settlements, they would put up signs saying, no entry for Palestinians, because that's where the harsher measures were put in place first. And so there is this kind of dissonance between what this pandemic could have, the effect this pandemic could have, and also the social and political dynamics in place. If someone, if a settler can go or can get in contact with someone who might have had the virus, they're not going to get it from only a Palestinian. They could get it from anyone who is exposed, but that hasn't fully kind of trickled down, this logic, and there is still very much this separation and segregation, even in the way that people are responding to the spread.
And you also need to take into consideration that you have a lot of the community of the Ultra-Orthodox in settlements. It's also quite high. You have Beitar Eli, for example, the Modi'in Elite, and also the outbreak is there as well. So the settlements, it's not only the national religious people, it's also Orthodox community, and they have the same level of, the rules for Israelis and Israeli settlements is the same. So they are allowed to go, to walk if it's necessary and everything else. I must say that from the Palestinian side, the measures of the PA that they were taken, they were very harsh as well. So we hear that there are checkpoints between Palestinian cities as well, running by the national security of the PA. And obviously in Area C, that's exactly where we see I think Area C and B, where you mostly see when you have settlers and Palestinians, you see the discrimination the most. Obviously, if the Palestinians is ill in Area C, so he will go and see a clinic in the West Bank, and or hospital in the West Bank. An Israeli settlement will go to an hospital inside Israel, and they live, 1 kilometer from each other.
It's also interesting to see how, because Israel is aware that the medical infrastructure in the occupied territories will not be able to handle the spread of the pandemic, they were quick to kind of coordinate with the PA to make sure that people are not outside. There was a lockdown on Bethlehem in the early days of the outbreak. But we're seeing that it is Palestinian laborers who come back from Israel who are contributing to the increase of cases in the Palestinian territories. And so there is this opposite movement of the virus than what Israel thought or prepared for, which is very interesting because, as Ran said, it's unclear yet how these workers are going to be treated and who's going to foot the bill for that.
Well, one thing we did see in the past couple days is that about 35,000 workers were returned to the West Bank, and what we're seeing is a spike in cases now as a result of those workers. I think something like at least 26 cases, new cases, have emerged directly from this cohort of returning workers in the West Bank.
If I could shift gears as we sort of get towards the end of this, one of the questions that I, in my optimism, have been asking the experts that we have before us is, all right, assume sort of blue skies. Imagine things are possible. We have this area with multiple communities living right together, right? And they're going to be distinct communities because in many ways they want, you have communities that are distinct. What should the Israeli government be doing? If tomorrow someone came to you from the Israeli Ministry of Health and said, give me your top 5 things that we need to do that will show seriousness and that can have some real impact and that can lead us forward into an era where we are better prepared to serve as, what you're saying, health is a right. How do we do that? So maybe offer some ideas. And maybe if you think that there's a way that this actually could happen coming out of this crisis, that would be helpful for those of us trying to think beyond just the terrible part to how we get beyond it.
So first of all, Israel should understand that health is something that you need to invest in. You need to invest, and we published a plan before one of the rounds of the elections. I don't even remember which one. We published a plan that Israel need to invest 14 million shekels in health, and it's not like what he's speaking about now. It's not an emergency. It's something that you look for the long run, because health, it's part of security, it's part of education, it's part of everything. And I think if there will be more, it will bring even after that more solidarity, understanding, if people, if the government will speak about solidarity, if the government will come with this messaging, it will be much more optimistic. If there will be investment in more in human resources in the health sector, one of the also amazing, I think, phenomenon that we see now is that the rise of the importance of the Palestinian citizen of Israel in the health system in Israel. And it's something that we know it. Many of our volunteers are Palestinian citizens of Israel. We go to Gaza with groups of doctors we used to go, let's say, to Gaza every 5-6 weeks with doctors who works in Israeli hospitals and serve everyone else. When I go and speak with the students or someone who is trying to make hard time on me and asking about who are your volunteers, and I'm saying, okay, my volunteers is the one who treat you when you go to hospitals. And they are Jewish, they are Arabs, it's everyone is contributor. So hopefully, it will bring more solidarity and understanding that health, it's not a privilege. It's really, really, really something which is so basic. I'm afraid we don't have the right people in the leadership to do that.
It's tough for me to answer this question because while there are obviously short-term measures that the government can put in place to better address public health crises in the future, it's hard for me to separate that from the larger vision informing the government and you know, unfolding right now. You know, as long as there is one group that's privileged over others, as long as the government is informed by Zionism, I can't see how any of these, you know, short-term immediate measures can be sustainable. Even if Palestinian citizens are better integrated in the government's institutions, even, you know, and we can already see how, you know, there are so many Palestinian doctors right now on the front line, just as much as Jewish doctors are. But still, because the larger policy, the larger ideology in place is that one group matters more than others, we don't see much of a shift in equality and injustice.
I think real quickly in the remaining minute, if we can, you know, I think what this raises for me is a question of at what point do Israelis realize, whether those in the authority or in the public in general, at what point do they realize that what happens in the West Bank, East Jerusalem, and the Gaza Strip directly affects them? For example, if you see the situation, the COVID situation under control in Israel, they get to a point where it's under control, somehow they flatten the curve eventually, and yet you have a surge or a major outbreak in either Gaza or the West Bank or both. Isn't there a risk of sort of reinfecting the Israeli public and that sort of boomeranging back to Israel? Is there a sense of that? That this is a long-term issue that needs to be addressed?
I think there is a good sense of that. I think Israel understands it very well that there is, you know, from the health perspective, it will be come back to Israel. What I am afraid is that Israel doesn't understand that the way we behave in the occupied territory is not only about health, the way we behave with our, you know, policy, it also has an impact about at least the statement of Israel as democracy. You know, you cannot be a soldier who goes to the occupied territories during 5 days and be an occupier and then go back home and be a liberal Democrat. So the impact is not only about health, it's all over the topics. And I think that's what should be the next level on health situation, on economical situation, to understand it very well. More from about the other values, I don't think it's still very clear to the leadership.
Henriette, do you have any last words before we close?
That sounds really scary. No, I just want to support what Ron said, that this is really, you know, there is an understanding that cooperation is important and that it's not about just taking care of the pandemic inside Israel's borders. But again, it is about shifting this mindset from from protecting Israelis, Jewish Israelis predominantly, to understanding that everyone can be affected by this. And that's why it's important to not only talk about access to testing and respirators and checkups, but also about the policies that affect who has access to these things and who doesn't. Because it is about these policies and not so, you know, in the long term, and not so much about the specific testing kits available and you know, respirators available.
Well, I guess I think we're going to have to leave it at that. I know we've covered a lot of ground, and yet I still feel like we've only scratched the surface on this issue. But thank you, Ran Goldstein and Henriette Shachar, for joining us today. It was a great discussion. Thank you to all our audience for tuning in. Thank you, Lara Friedman, Foundation for Middle East Peace, for co-hosting this series with us at the Middle East Institute. And a reminder that this video and the other previous 2 sessions will be up on the MEI website and also FMEP's website. So thank you all, and we hope to have you back again soon.
Thank you.
Thank you.